Welcome to the Plan B channel, where we provide information about HIV treatment that is accurate, up-to-date and unbiased. My name is Ben Plumley. I'm a global AIDS strategist and advocate, and I'm committed to helping people with HIV get the right treatment information so they can make decisions about their treatment to live long, healthy lives. This episode, our first episode on viral load, and we're joined by Dr. Royce Lin, an internationally respected HIV specialist from the United States of America, and he is Associate Clinical Professor at the University of California in San Francisco. A delight to have you here, Dr. Lin. Welcome.
Thank you.
So let's talk about viral load, a concern, a question for many of our patients. First of all, can you tell us what is a viral load test?
Yes. So a viral load test measures how many copies of HIV virus is in a particular unit of blood, usually in 1 ml. So the higher the viral load, the more virus there is in someone's body. And this is important information because having a high viral load tells us that someone's at risk of progressing more quickly towards advanced HIV. So for example, someone who has a viral load of 100,000 would be progressing very, very quickly towards more advanced immunosuppression versus someone who has an undetectable viral load because they're on effective treatment. And that really is the goal, because when somebody's viral load is undetectable, then you can't see any virus reproducing inside the body. And so with the HIV being completely stopped, people's immune system can regrow, can come back. And that really is the goal of HIV treatment, is to get to an undetectable viral load.
So how many viral load tests do you recommend a patient has per year?
Yes. So I think in general, in someone who is already on HIV medications, has already reached an undetectable viral load and has good adherence, you really don't need to check very often, once or twice a year. I generally check every 6 months, just to make sure. And if the viral load is unexpectedly detectable, then you know you have a problem. And it's either because someone's not able to take their medications regularly, or maybe a drug-drug interaction lowering the levels of medications in the body, or somebody has developed viral resistance. So viral load is important to check periodically. I do tend to check a little bit more often, Ben, in the beginning. So if somebody has never started HIV treatment before, I'll usually request a baseline viral load, and that is to understand at what level does the virus like to be at without treatment in place. And then after starting treatment, you generally within the first 3 months, by month 3, I would check a second viral load. So the reason for that is that the treatment options that we have these days are very, very powerful and very effective. And as long as a patient is taking their HIV medications regularly, I would expect that by 3 months, the viral load is undetectable. And if it's undetectable, fantastic. That is exactly what we want. But if it's detectable, then that tells us that something is not going quite right. And then you and your doctor would then go on to try to figure out where the problem might be, so we can make some course corrections, some adjustments, and hopefully get that viral load down to undetectable quickly.
Well, that's very helpful, Dr. Lin. Thank you very much indeed. This is the first of 2 episodes about viral load, and so we'll come back to this in the next episode. But thank you all for watching. In a moment, you'll see a screen that will provide links for HIV information in your country, as well as links to us at Plan B. We would love to hear from you, your thoughts, your suggestions. So thanks for watching.